Hi, everybody. So my name is Ioannis Tsigkos, and today I will give you a brief description of my project, which is named Bioengineering 3D Leukemic Microenvironments to enhance bone marrow transplantation. So leukemia refers to a group of cancers that mainly affect the blood. They can be classified to a couple of subtypes according to the original cell from which the disease was originated, as well as the aggression of the disease. However, in this project, we're focusing on acute myeloid leukemia, which is the most lethal and the most prevalent among all the leukemic types. For the last 50 years, we're still using the same chemotherapy regimen as the frontline therapy. However, even then, up to 60% of the patients that receive this chemotherapy can experience disease relapse, or other patients cannot accept this chemotherapy. They are refractory to it because of other underlying conditions. In that case, patients can only benefit from bone marrow transplantation. But again, even then, up to 55% of those patients can experience disease relapse. And after this, the prognosis is very dismal. So from the bone marrow transplantation, what we're actually interested to transplant is the hematopoietic stem cells that we also call HSCs. Like every other stem cell, they have the ability to self-renew and differentiate, and most importantly, to regulate the normal physiology of the blood. So the activity of the HSCs is tightly regulated by another stem cell type called the mesenchymal, which we also call MSCs. So in the bone marrow, the mesenchymal stem cells tightly regulate the HSC activity via their supportive properties. However, the problem arises when we remove the mesenchymal stem cells from their natural environment and their supportive properties quickly get lost. Therefore, in this project, we have developed a platform that you can see on the left-hand side of the schematic representation, which can maintain the supportive properties of the MSCs towards the HSCs. And overall, we believe that by following this methodology, we will be able to develop a combined cellular therapy of MSCs and HSCs that will enhance bone marrow transplantation. Bone marrow transplantation is a phenomenon whose efficiency we will check with the help of a platform that you can see on the right-hand side of the schematic representation that mimics the leukemic microenvironment by the use of soft hydrogels that mimic the softness of the bone marrow and includes within it the MSCs, the leukemic cells, and many necessary proteins. The experiments are still ongoing. However, we have preliminary data that indicate a very positive potential, and most importantly, a personalized potential, which means that in the future we will be able to develop personalized cellular therapies with the cells of each patient, as well as to develop personalized leukemic models that will help facilitate the screening of novel anti-cancer therapies and personalized medicine. Thank you very much.